Ευχαριστώ πάρα πολύ. Thank you very much, Dr. Antonioiannakis and Dr. Brilakis, for the invitation. This course continues to get better and better. It's a fantastic course. It's my pleasure to speak today about lower trapezius tendon transfer for irreparable posterior superior rotator cuff tears. I'd like to first start off with the rationale, history, and biomechanics, followed by the indications, techniques, and results. So as we know, irreparable posterior superior rotator cuff tears are a very challenging problem, particularly in our younger, more active patients. And latissimus dorsi has been most commonly used to reconstruct these tears. However, the lower trapezius tendon is a newer technique that has potentially a more anatomic transfer, thus providing some potential advantages over latissimus dorsi. The origin of the lower trapezius is cranial to the latissimus dorsi and it's medial to the infraspinatus fossa. Therefore, the lower trapezius does have a nearly identical line of pull as the infraspinatus. Its excursion and tension forces are also very similar to the infraspinatus. And EMG studies have demonstrated synergistic external rotation activation, thus it's an in-phase transfer. Dr. Bassem El-Hassan is the innovator and the champion of this technique. He initially developed it for use in patients with brachial plexus palsy. Two posterior incisions were used, one medially to harvest the lower trapezius and one laterally, through which the posterior deltoid was detached to access the humeral head. The technique was expanded for indication of rotator cuff deficiency, and the lateral incision was made more superiorly over the acromion so that an acromial osteotomy could be performed. It was further refined so that now we do arthroscopic fixation of the Achilles tendon allograft to the greater tuberosity, avoiding the need for acromial osteotomy. There are a few biomechanical studies in the literature. Dr. El-Hassan's group looked at a biomechanical model and found that lower trapezius had better external rotation moment arm than the latissimus dorsi in 0 degrees of abduction. Although in 90 degrees of abduction, the latissimus dorsi had a slightly better moment arm than the lower trapezius. This group out of Southern California compared lower trapezius with latissimus dorsi, again in a massive rotator cuff deficient model. They found that lower trapezius was better than latissimus as far as restoring the native glenohumeral joint kinematics and the joint reaction forces in 0, 30, and 60 degrees of abduction. Lower trapezius also provided better centering force and restored compressive forces better than latissimus dorsi. Finally, Dr. El-Hassan's group also looked at a dynamic shoulder simulator model. They found that both lower trapezius and latissimus dorsi achieved a significant increase in maximum abduction angle. Both improved superior humeral migration compared with the rotator cuff deficient state. And they found that lower trapezius required significantly less compensatory deltoid forces compared with the rotator cuff deficient state. This was actually not observed for latissimus dorsi. So our current indications are for patients with irreparable posterior superior rotator cuff tears, no glenohumeral joint arthritis, external rotation weakness with or without an external rotation lag, and preserved range of motion, particularly good active forward flexion and good global passive range of motion. Contraindications include deltoid deficiency, inability to comply with the post-op protocol, subscapularis deficiency, which is now a relative contraindication, as well as a relative contraindication of physiologically advanced age. The technique, briefly, is arthroscopic evaluation, either before or after lower trapezius tendon harvest, Achilles allograft preparation, which can be done simultaneously if you have another set of hands in the operating room, graft passage of the Achilles allograft from medial to lateral arthroscopically, arthroscopic fixation of the graft on the greater tuberosity, typically with 4 suture anchors, and finally fixation of the Achilles tendon allograft to the lower trapezius after placement of the arm in abduction and in external rotation. So now looking at the literature, this is Dr. El-Hassan's first report on his arthroscopically assisted transfer cohort. At mean 14-month follow-up, 90% of patients had significant improvement of all outcome scores. Interestingly, presence of a subscapularis tear did not affect the outcome negatively. There were 3 patients who had pre-op rotator cuff arthropathy changes. These patients had persistent pain and limited range of motion and subsequently underwent reverse shoulder arthroplasty. Dr. Valenti has reported on his series of 14 patients, 10 isolated lower trapezius and 4 combined with latissimus dorsi transfer at 24-month follow-up. There was significant improvement in external rotation as well as all outcome scores. There's a resolution of the ER lag sign and hornblower sign in all patients who had one preoperatively. 2 hematomas and 1 revision for infection were the complications reported in this series. This group out of Rothman Institute reported on 15 patients, 9 open, 6 arthroscopically assisted. 3 or 20% of these patients underwent subsequent conversion to reverse shoulder arthroplasty, but of the remaining 12 patients at mean 24-month follow-up, there were significant improvements in outcome scores, significant improvements in forward elevation, abduction, and external rotation, as well as good satisfaction overall and good return to work in the return to work eligible patients. They noted that limited preoperative active forward elevation, specifically less than 90 degrees, predicted poor functional results and risk for reoperation. Most recently, Dr. Murthy's group reported on their series of 19 patients. Interestingly, they got an MRI on all 19 patients at 6 months postoperatively, and high rates of healing, almost 90% rate of healing of the tendon transfer on these MRIs at 6 months follow-up. Significant improvements in pain, ASES scores, and PROMIS scores, as well as improvements in external rotation and strength. And in all the patients who had a preoperative external rotation lag sign, all patients had resolution reversal of that ER lag sign, as well as good return to work overall in the work-eligible patients. There's one systematic review in the literature currently looking at 159 patients. This study found improvements in forward elevation and external rotation, as well as reversal of the ER lag in all patients who had an ER lag preoperatively. All outcome scores improved. The overall complication rate in the cohort was 17.6%. Most common complication was harvest site seroma or hematoma in 6.3%, and 5% of patients had subsequent conversion to reverse shoulder arthroplasty. There are a few studies in the literature comparing lower trapezius to other modalities. This study out of South Korea looked at lower trapezius compared to superior capsular reconstruction at minimum 2-year follow-up. They noted significant clinical improvements in both groups. However, lower trapezius had better improvements in forward flexion, external rotation, post-op ASCS score, as well as patient satisfaction post-operatively. They had higher rates of progression of arthritis in the SCR group, 22%, as compared with the lower trapezius group, only 2.8%, as well as a higher graft re-tear rate by MRI in the SCR group as compared to the lower trapezius group. The same group looked at lower trapezius comparing those patients to latissimus dorsi at minimum 2-year follow-up. They found significant clinical improvements in both groups. Again, lower trapezius, the lower trapezius cohort had better active external rotation, better post-op ASES scores, and a lower rate of progression of arthritis as compared to the latissimus dorsi group. This study out of Mayo Clinic, interesting study looking at lower trapezius comparing with SCR. Preoperatively, the patients with a more substantial ER lag were preferentially treated with lower trapezius tendon transfer. At mean 3-year follow-up, there are no significant differences in patient-reported outcome scores, but interestingly, SCR patients had less pain, better elevation, and marginally better strength in elevation. The lower trapezius group had greater improvements in external rotation compared with the SCR group. There were no differences in complication or reoperation rates in this cohort. Finally, Dr. Warner's group out of MGH looked at 163 SCR patients comparing with 24 lower trapezius patients. Both procedures improved outcomes at each postoperative time point. Pain and outcome scores were comparable, and there were no significant differences at 2 years postoperatively. So in conclusion, lower trapezius tendon transfer is a more anatomic tendon transfer option, which can now be performed in arthroscopically assisted technique. It has overall good short-term results. It provides a dynamic transfer with the ability to improve range of motion and strengthen an external rotation, and it's a promising treatment option for this difficult patient population. Ευχαριστώ πάρα πολύ.